Imagine going to your doctor for a routine checkup. You feel perfectly healthy and completely normal today. The doctor looks at your routine blood test results. Their face suddenly drops and becomes very serious. They tell you your kidneys are failing rapidly. You are entirely shocked and confused by this news. You have never had kidney problems in your life, but you have been taking your blood pressure medication. This medication was supposed to protect your heart health. Instead, it has been silently destroying your delicate kidneys. Millions of seniors face this exact terrifying scenario daily. The pharmaceutical industry heavily markets these specific drugs. They promise perfect blood pressure monitor readings every time, but they ignore the catastrophic collateral cellular damage. Our clinical medical board reviews raw biological data daily. We ignore pharmaceutical marketing and outdated medical dogmas entirely. We focus strictly on peer-reviewed, objective biological truth. You need raw clinical data to protect your organs. I invite you to subscribe to this educational channel today. Join our exclusive community of dedicated biological truth seekers. Let us decode exactly how these 5 pills work. Think of your kidneys as an advanced water filtration system. They are the intricate plumbing filters of your body. They constantly clean your blood of dangerous toxic waste. To push fluid through these filters requires strong pressure. Your heart acts as the main water pump. It pushes blood forcefully through your delicate kidney filters. If the water pressure drops too low, the filters stop. The toxic waste begins backing up into your bloodstream. Your kidneys physically require a minimum blood pressure level. They need this pressure to effectively clean your blood daily. This biological requirement creates a massive pharmaceutical trap. Modern medicine insists everyone must have low blood pressure. Doctors aggressively prescribe heavy medications to force numbers down. They use 5 specific classes of blood pressure drugs. The first class is known as ACE inhibitors. Examples include common drugs like lisinopril and enalapril. The second dangerous class is known as ARB medications. These include highly prescribed drugs like losartan and valsartan. The third class involves powerful loop diuretic water pills. Furosemide is the most common example of this class. The fourth category includes strong thiazide diuretic medications. The fifth class contains specific harsh calcium channel blockers. These 5 drugs chemically force your blood pressure down. They artificially weaken the main basement water pump. They also aggressively drain the fluid volume from your system. Your blood pressure monitor suddenly looks absolutely perfect, but your kidney filters are suddenly starving for pressure. The blood is no longer pushing through the filtration system. Your body is silently accumulating dangerous systemic toxins. Your delicate kidney cells begin to suffocate without oxygen. This lack of oxygen causes permanent internal tissue scarring. The clinical medical term for this is acute kidney injury. It silently accelerates irreversible chronic kidney disease in seniors. You feel no pain while your organs slowly die. Let us examine the first specific class of drugs. ACE inhibitors, like lisinopril, are prescribed to millions globally. They block an enzyme that normally constricts your blood vessels. This successfully lowers the pressure inside your major arteries. But your kidneys rely on that specific constriction mechanism. Your kidneys use that constriction to maintain internal filtration pressure. When you block it completely, the internal pressure plummets. The filtration process grinds to an absolute physical halt. Toxic waste immediately begins accumulating in your bloodstream. The second class involves angiotensin receptor blockers, or ARBs. Drugs like losartan act on the exact same biological system. They block the specific receptors that cause vascular constriction. They carry the exact same severe risk of kidney starvation. The third highly dangerous class is loop diuretic medications. Furosemide is aggressively prescribed to remove excess body water. It forces your kidneys to rapidly excrete sodium and fluid. This violently reduces your total systemic blood volume quickly. Less blood volume means less pressure pushing through the filters. Your kidneys become severely dehydrated at a microscopic cellular level. This extreme dehydration causes the delicate kidney cells to die. The fourth dangerous category involves thiazide diuretic blood pressure pills. Hydrochlorothiazide is frequently combined with other strong cardiovascular drugs. It slowly drains your total fluid volume over many months. This chronic, subtle dehydration is incredibly dangerous for senior kidneys. Aging kidneys already have a naturally reduced total blood flow. Draining more fluid pushes them over the biological edge. The fifth class involves specific harsh calcium channel blockers. While some are protective, others can violently alter internal pressure. When combined with diuretics, they create a perfect lethal storm. This combination is known clinically as the triple whammy effect. Taking an ACE inhibitor with a diuretic and ibuprofen. This specific combination destroys senior kidneys faster than anything else. You must understand how these drugs interact chemically inside you. Let us look deeper at the biological symptoms of failure. Your kidneys do not have pain receptors to warn you. You will not feel a sharp pain as they die. The first symptom is often an unexplainable deep physical exhaustion. Your blood is becoming thick with unassigned toxic waste. You might notice a strange metallic taste in your mouth. Your ankles and lower legs might begin swelling with fluid. Your kidneys are failing to remove the normal daily water. You might experience severe muscle cramps during the night. This happens because your critical electrolyte balance is completely destroyed. Severe potassium imbalances can trigger immediate and fatal heart arrhythmias. This is why you cannot ignore these subtle biological warnings. The medical establishment often dismisses these symptoms as normal aging. They tell you to simply rest and take your pills. This is a massive dereliction of basic clinical medical duty. You must demand raw clinical data from your primary physician. You must advocate fiercely for your own internal cellular health. You must actively protect your vulnerable kidney filters today. The actual clinical protocol requires highly personalized, daily metric tracking. You must never accept a blind, universal blood pressure target. You must regularly test your specific kidney function markers. Ask your physician to measure your glomerular filtration rate. This specific metric tells you how fast your filters work. You must also monitor your blood urea nitrogen closely. Track your specific serum creatinine levels every single month. If your creatinine rises, your kidneys are likely starving. They are begging for more blood flow and pressure. You must track your daily energy levels very carefully. Extreme unexplained fatigue is a symptom of toxic buildup. You must discuss these personalized targets with your physician. Ask them if they are treating the monitor or you. Remind them that aging kidneys require higher perfusion pressure. A slightly higher blood pressure might save your kidneys. You must ensure you are adequately hydrated every day. Dehydration combined with these medications destroys kidney tissue rapidly. Drink clean water to keep the fluid volume steady. Focus on high-quality proteins and fresh organic vegetables daily. Your diet directly impacts the workload placed on your kidney filters. By eating clean foods, you reduce the required filtration effort. This gives your damaged kidneys critical time to physically heal. You must also completely avoid over-the-counter pain medications. Drugs like ibuprofen and naproxen are highly toxic to kidneys. They constrict the tiny blood vessels entering the kidney filters. Taking them while on blood pressure pills is incredibly dangerous. Always ask your pharmacist about potential severe drug interactions. You are the ultimate manager of your personal biological health. You must take this responsibility incredibly seriously every single day. Never alter your prescribed medications without strict medical supervision. Sudden changes to cardiovascular medications trigger severe rebound effects. Rebound hypertension can cause immediate and lethal strokes today. You must carefully taper these powerful drugs over time. Always work directly with a qualified medical professional, safely. We will continue to review the peer-reviewed clinical data. Protect your cardiovascular health and stay perfectly objective, always. Thank you for seeking the biological truth with the Medmetrics today.